What is up, yo guys? It's your girl back at it again with another educational video. How are you, everyone? Despite of this pandemic, we will still be continuing to learn, and learn. For today's topic, we will be talking about what is gestational hypertension. But this video is kind of little different because I have some backups together with my nursing classmate who will further explain what is it all about. So, without further ado, let's have a blog takeover.
Gestational hypertension is a form of high blood pressure in pregnancy. It can be developed into preeclampsia. This condition occurs often in young women with the first pregnancy. It is more common in twin pregnancies, in women over the age of 35, in women with chronic hypertension or who had hypertension in a previous pregnancy, in African American women, and in women with diabetes. Gestational hypertension is diagnosed when blood pressure readings are higher than 140 over 90 millimeter mercury in a woman who had normal blood pressure prior to 20 weeks and has no proteinuria.
The following signs and symptoms of gestational hypertension are increased blood pressure, edema, headache, stomach pain, sudden weight gain, vision changes such as blurred vision or double vision, and also making small amounts of urine.
Now we will talk about nursing care management. So first, we need to monitor the vital signs, particularly the blood pressure. The reason behind this one is that the BP might fluctuate and spike too quickly, so we need to monitor for changes and evaluations. The next one is we need to assess for edema, and the reason for this one is that it can be a significant sign of decreased cardiac output. The next one is that we should weigh the patient because we can see here the possible progression of a disease where it can lead to impaired renal function. The next one is that we should assess for the heart and the lungs because we need to monitor the signs of fluid overload and pulmonary edema, which can put a strain on the cardiopulmonary system. And also we need to administer the proper IV fluids and medications because it can also help in controlling the disease. And also need to remember that antihypertensives and magnesium sulfates are to be given to patients that are preeclamptic. And lastly, we need to monitor for the fetal heart rate. Rationale behind this one is that the symptoms of fetal distress is due to maternal blood flow. And that's all.
Gestational hypertension is a form of high blood pressure in pregnancy. This condition can affect the health of both mother and the baby depending on how severe the issue is.
This may decrease blood flow in your liver, kidneys, brain, uterus, and placenta. This condition can get worse. It can lead to preeclampsia and eclampsia.
It's empowering to encourage other women to push despite of all the complications they are having. It's inspiring to see life blossom in front of you. And it's such a joy to deliver a baby amidst all this situation. And we are meant to do that job.
Hey everyone, it's me again. Now we're finally at the end of the video. I just wanted to say that to all the future nurses out there, may we do our job honestly, correctly, and wholeheartedly. And for our future patients with gestational hypertension, may you always consult your doctor first because it's not just your life who is at risk, but your baby's life as well. Now, that is all you guys. I hope you learned something. Bye!